Well, lucky for you, Natalie, you're going to be able to. And I want you guys to remember that you can do the practice exams at any time and as many times as you want. Just make sure that you do the study mode first. That way you can take notes and then you can do the practice exam. All right, so let's go ahead and get started with grading the Chapter 16 study guide. Are we doing odds or evens today? Lily, you may have to log out and jump back on. Can you hear me better? Okay, good. All right, so are we doing odds or evens? Talia, Sabrina, Jasmine, Natalie, can everyone hear me? Okay, good, good. Okay, so are we doing odds or even for chapter 16? All right, thank you, Natalie. Okay, so evens. 2 is true, 4 is true, 6 is false, 8 is true, 10 is true, 2 is false, 4 is true, 6 is false, 8 is true, 10 is false. Key term assessment. 2 is D, as in David. 4 is T for Tom. 6 is U for umbrella. 8 is K for kite. 10 is N for never. 12 is C for cold. 14 is M for mighty. 16 is B for bike. 18 is O for over. 12 is P for pull. 22 is W for win. The word parts. You should have 2 answers. Number 1, without or absence of, I'm sorry, evens. 2 is urine. 4 is bilirubin. 6 is sugar. 8 is ketone. 10 is night. 12 is many. 14 above. 16 pertaining to. Evaluation of learning. Number 2, to store and expel urine. Number 4, the external opening of the urethra. 6, excessive intake of fluids that contain caffeine or diuretics. Diabetes mellitus, diabetes insipidus, and renal disease. Number 8, clean catch midstream specimen. 10, kidney stone formation. 12, An acidic urine becomes more alkaline, which also may cause a false positive result on the protein test. Bacteria multiply, which results in a cloudy specimen and an increase in the nitrate concentration. If glucose is present in the specimen, it decreases in amount. Any red or white blood cells present may break down and cast decompose. Number 14, presence of bacteria, pus, blood, fat, yeast, sperm, mucus threads, and fecal material. 16, it provides information on the ability of the kidneys to dilute or concentrate the urine. 18, qualitative test results provide an approximate indication of whether a substance is present in abnormal quantities. Quantitative test results indicate the exact amount of a chemical substance that is present. 20, urea is converted to ammonia by bacterial action. 22, glomerular filtration problems, renal diseases, bacterial infections of the urinary tract. 24, gallstones, hepatitis, and cirrhosis. 26, a false positive result may occur because of bacterial contamination from the atmosphere. 28, to help clarify the results of the physical and chemical examination of the urine. 30, it causes them to become shrunken or crenated. 32, candidiasis. 34, for early detection of pregnancy, before certain medications are ordered, before procedures are performed, they may cause injury to a fetus. 36, clean urine containers should be used. A first voided morning specimen should be used to perform the test. The specific gravity of the urine specimen should be determined before the test is performed. A specific gravity reading of less than 1.010 may lead to false and negative test results. The urine specimen should be at room temperature. The urine pregnancy testing kit should be stored according to the information on the product insert. Test reagents past their expiration date should not be used. If more than one patient is being tested at a time, each testing device should be labeled to prevent mix-up of specimens. If the internal control does not perform as expected, the test result is invalid and the specimen must be retested. Testing of a positive and negative external control should be performed with each new lot of pregnancy testing kits and then monthly thereafter. All right, make sure you send me your results for your chapter 16. And I have only received just a handful of the chapter 15 study guide. So please make sure that that is sent today. So on yesterday afternoon's live lecture, we were talking about chapter 16, right? Urinalysis. And then I sent a message and remind that I wanted to talk about this morning. So as a medical assistant, how would you explain to your male and female patients on how to do a clean catch midstream specimen? And I want to go ahead and see what you guys think. Ladies, some feedback would be great. All right, Natalie, female wipe front to back with sterile wipe, and males need to clean the head of penis with a sterile wipe. Very good. So that's correct. So, but the question is, how would you explain that to your patient? The male part would be correct. That should pretty much be on point. But for the female, that can be a little tougher. So how would we explain it to our female patients? Talia, what do you think? How would you explain to the female patients?
I would basically tell them like it's better off to wipe front to back just to stop from any, I guess germs, anything causing irritating in their vagina or something,
Okay.
So,
So let me ask this. On female patients, where are they to wipe from front to back?
can you repeat that?
On female patients, where are they to wipe from front to back? Where? I mean, do you wipe just like a female after using the bathroom, or do they have to be a little bit more detailed on how they're wiping? Labia, Lily, that's right. So, so that's correct. The reason I'm doing this is because it's really common as a medical assistant that you have to explain to your patients how to perform the test so we can make sure that we're getting accurate results. The problem that can occur is that some patients may not understand labia. They may not be very familiar with the name of the anatomy, right? So what I want you ladies is to get in the habit of thinking on how to be able to explain to your patients, whether they're male or female, in a way that they can understand and you're able to get the information across, right? So that's why I'm asking this because it is very common for if I advise a female patient that you need to um, wipe from front to back around the labia, they may not know what that is. So that's what I want you ladies to kind of get in the habit of is to start kind of thinking, okay, how can I explain this to my patient so that they understand what I'm saying and we can also get accurate results because the test was performed accurately. Okay. Any questions on that? I know it's kind of odd, but it's so common. So I want you ladies to kind of be thinking about
I
that.
have a question.
Of course.
So some people don't know like the proper terms for like their body parts and stuff. So is it like professional to use slang like boobs and other stuff?
It, eh, um, that's actually a really good question, Ellie. So we have to be professional, right? A lot of times, you may have to not really use slang, but use like some patient on a female patients, you can say that you need to wipe around the lips. They probably know what that would be. And in other cases, very commonly, you may actually have to show them. Some offices have diagrams, right, or little molds of the anatomy, and you can visually show them how to wipe. So, I mean, yeah, I guess you can say slang, but not, we need to do professional slang.
Oh, because I remember, I remember when I was little, I would just kept saying like my boobs and all that, and I was like, I don't know if they understood that or something.
Well, yeah, and they probably do. So, like, I can tell you that for my daughters, right, they know that they will refer to either boobs or breast. Now, when we're talking about the vaginal area, they will still use the word their misses, right? But in some cases, they kind of like they'll point like misses, well, not now because they're older, but that's how, but that's a way to communicate with your patient, right? If they have a term that they use for that anatomy, you can use that term to explain to them. Um, so that's very helpful to do. But
Okay,
yeah,
because I was like, so what if they don't know like proper term? What do we say?
yeah,
Like not insult them and stuff, because some slang words are like really
right.
bad.
Right. Well, exactly. Like we don't want to do anything derogatory or very unprofessional, but you can do slang. I mean, I'd say slang, but I guess other words to describe the area. Excuse me, I'm losing my voice. Without having to use the actual anatomy name, right? Or you can say, you need to clean around the labia, and those are the lips on the inside of the vagina, right?
Mhm.
So they probably know that terminology. For males, generally, you could say that you need to clean around the head of your penis, or with males, it's a little easier, honestly. It's females that can kind of get kind of tricky. Now, let me ask one more thing. For males, if a patient is not circumcised, would they need to do anything different than if your patient was circumcised?
Pull back the skin.
Yes. And that's exactly how I would advise my patient. Very good. Good. Any other questions? Okay, well, let's go ahead and get started on chapter 17. So we're going to start with the chapter in the book, and then we are going to go over some things in our baggie and in our binder, because you are going to have some assignments to do today in your binder, okay? All right, so chapter 17 is phlebotomy. Does anybody know what phlebotomy would mean?
It's collecting of blood.
One more time.
Collection of blood.
Yes, collection of blood. That's right. So this is something that as a medical assistant, you will be doing. And hopefully, you'll get to do this a lot. But we do need to know how to collect blood and what to do with it once we've collected it and how we collect it. Okay. So that's what this chapter is going to go over to. This is another one of my favorites. It's a fun chapter, right? Um, so we're going to get started on that. So I want all you ladies to go and turn your book to page 618. And Jasmine, can you go ahead and read Introduction to Phlebotomy?
The purpose of phlebotomy is to collect a blood specimen for laboratory analysis. The word phlebotomy is derived from the Greek words for vein, phlebos, and incision, otomy, and literally means making an incision into a vein. As used in the clinical laboratory sciences, phlebotomy is defined in general as a collection of blood. An individual who collects a blood sample is a phlebotomist. Some blood specimens are tested in the medical office and others are picked up and taken to an outside laboratory for testing. The latter specimens need to be placed in a biohazard specimen bag along with the laboratory request, so that laboratory personnel know what type of test the provider desires. The medical assistant may be responsible for completing the laboratory request form either on the computer or manually. The request form includes the provider's name and address, patient's name, address, age, and gender, the date and time of collection of the specimen, the International Classification of Diseases, uh, the International Classification of Diseases ICD-10 code of the clinical diagnosis, and a mark next to the type of test or test to be performed. Phlebotomy encompasses three major areas of blood collection: arterial puncture, venipuncture, skin puncture. An arterial puncture is typically performed in a hospital to assess the oxygen level, carbon dioxide level, and acid-base balance of arterial blood. Medical assistants do not perform arterial punctures. In the medical office, medical assistants perform venipunctures and skin punctures. This chapter focuses on these two ways to obtain blood.
All right, very good. Thank you. Okay, so in the first paragraph, I want you ladies to go and highlight where it says phlebotomy is defined in general as a collection of blood. An individual who collects a blood sample is a phlebotomist. In the third paragraph, I want you to highlight where phlebotomy encompasses three major areas of blood collection: arterial puncture, venipuncture, and skin puncture. All right, so let's start with venipuncture. Lily, can you please read venipuncture?
Venipuncture means the puncturing of a vein for removal of a venous blood sample. In the medical office, a venipuncture is performed when a large blood specimen is needed for testing. Venipuncture is usually performed in the medical office using the following method: vacuum tube method and the butterfly method. The vacuum tube method is faster and the most convenient method, and it's used most often. This method relies on the use of an evacuated tube, which is closed gas, or plastic tube that contains a vacuum. The butterfly method is used for difficult draws, such as when a vein is small or suppressed. This chapter presents the theory and procedure for both of these methods.
Very good. Thank you. Yes, sclerose. So, sclerose, it's hardening. So for venipuncture, you're going to highlight the first sentence and highlight the 2 bullet points. And then right under the bullet points, I want you to highlight that the vacuum tube method is the fastest and most convenient method. And highlight the words evacuated tube. General guidelines for venipuncture. General guidelines that are common to both methods of venipuncture include verifying any advanced preparation, reviewing specimen collection and handling requirements, identifying the patient, reassuring the patient, assembling equipment and supplies, positioning the patient, applying the tourniquet, selecting a site for the venipuncture, obtaining the type of blood specimen required, and following the Occupational Safety and Health Administration, OSHA, and bloodborne pathogens. Patient preparation for venipuncture. Natalie, can you go ahead and read that, please?
The patient should be given instructions an appropriate number of days before the specimen collection on any advanced preparation that is required. Although most tests require no preparation, some tests require fasting or the avoidance of certain medications. Fasting involves abstaining from food or fluids except water for a specified amount of time for the collection of specimen. If the medical assistant is unsure whether a laboratory test requires advanced patient preparation, an appropriate reference source should be consulted. If the specimen is being tested at an outside laboratory, References consist of a laboratory directory, laboratory website, and the laboratory's technical support staff. If the specimen is being tested at the medical office, references include the manufacturer's operating manual and/or product inserts included with the blood analyzers and the testing kits. When a laboratory test requires advanced preparation before performing the venipuncture, verify that the patient has prepared properly. If the patient has not properly prepared, do not collect the specimen unless directed otherwise by the provider. If the venipuncture is to be rescheduled, carefully review the preparation requirements with the patient.
All right, very good. So for the patient preparation, I want you ladies to highlight the first sentence. Now, if you're in the medical office, you will have access to laboratory directories. So if your office uses LabCorp and Quest and maybe another type of laboratory, you probably will have those laboratory references in your office that you can review. It's almost similar to a PDR, but for our lab. So it tells you your CPT codes for the test. It'll tell you what tubes you're going to need to use and how much, and then what to do after the tubes or after you obtain your specimen. All right, very good. So now we're going to do review, collection, and handling requirements. Talia, can you go ahead and read that for me? Talia, can you hear me, sweetie?
Oh, yes, my computer had turned off. Do you
Oh,
want
that's
me
okay.
to review and collection?
Yes, ma'am.
Okay. The medical assistant must review the requirements for the collecting and handling of the blood specimen. These include the collection supplies necessary, the type of specimens to be collected, serum plasma, whole blood, clotted blood, the amount necessary for laboratory analysis, and techniques to follow to collect the specimen and the proper handling, storage of the specimen. The medical assistant must refer to the appropriate reference source to determine the collection and handling requirements for each test ordered by the provider. If the specimen is transported to an outside laboratory, this information is indicated in the exam in the lab directory or laboratory website. Figure 17.2 shows an example of the collection and handling requirements for a complete blood count (CBC) as it is presented in a laboratory directory. The collection and handling requirements necessary for specimen tests in the medical office are listed in the manufacturer's instructions that accompany the test system.
Very good. Okay, so for the review, collection, and handling requirements, I want you ladies to highlight where it says if the specimen is transported to an outside laboratory, this information is indicated in the laboratory directory or laboratory website. Figure 17.2 shows an example of the collection and handling requirements for a complete blood count, CBC, as is presented in the laboratory directory. Now, really quickly, let's take a look at figure 17.1. So this is a specimen in a biohazard bag along with the laboratory request form. In the biohazard bag, there are two slots. Usually it's like a Ziploc at the top. That's where you're going to put your specimen. And then there's a little pocket on the back that you'll put the laboratory request form. Okay. Identification of the patient. Jasmine, can you go ahead and read that, please?
It cannot be emphasized enough how important it is to identify the patient using two forms identification, example name and date of birth, before performing a venipuncture. Proper patient identification is essential to avoid collecting a specimen from the wrong patient. After greeting the patient, the medical assistant should ask the patient to state his or her full name and date of birth. This information should be compared with the demographic data indicated in the patient's medical record. The patient should not be asked whether he or she is a certain patient For example, the patient should not be asked, "Are you Brad Thompson?" The patient may not hear the medical assistant correctly or may not be paying attention enough and may answer in the affirmative even if he is not that patient. Instead, ask the patient for his or her name and date of birth. If the patient is not properly identified, this in turn could lead to incorrect labeling of the specimen. A specimen that is not identified correctly could lead to an incorrect patient diagnosis and the wrong treatment.
Very good. Okay, so for the identification of the patient, you're going to highlight where it says, after greeting the patient, the medical assistant should ask the patient to state his or her full name and date of birth. Highlight this information should be compared with the demographic data indicating the patient's medical record. So just like when we greet our patients to call them back, we need to do the same thing before we obtain any specimens. And then usually what I like to do is once I ask the patient to state his or her full name and date of birth, I will go ahead and then compare it to the demographic sheet. And then I usually will go ahead and fill out the name, his or her full name and date of birth on the lab requisition, and then I like to show them that, and can you please verify that that is correct. Okay. All right, so let's go on over to page 620, and I'm going to go ahead and take a look at the figure 17.2. So when you guys are looking into a laboratory directory, and we do have some in the clinic, so I'm going to also be able to show you when we get to the clinic. And this is kind of an example. So a CBC with differential and platelet count, it shows a CPT code, which remember CPT codes, you can remember those as those are your procedures, right? That's what we're doing for our diagnosis. Diagnosis codes are ICD-10 codes. Okay, so remember that's the difference. So this is going to be your testing code, your CPT. It tells you what is involved in that test, like what does that test inform? The type of specimen, the amount that you need to draw, the supplies you're going to need. So this is showing that it's a lavender EDTA stopper tube. And if you look in your baggie, y'all, I'm sorry, my dog is behind me. See if I can get it out here. All right. So this would be considered a lavender top, right? And then if you look, it has some substance in it. That's our EDTA, and I believe we will be reviewing that in this chapter in just a moment. But that's our lavender top, okay? Now, it says a collection technique. Red stopper and SST tubes, and again, we'll go over that in a moment, should be collected before the lavender stoppered tube. Completely fill tube to the exhaustion of the vacuum to ensure a proper blood to anticoagulant ratio. Gently invert tube 8 to 10 times immediately after drawing to mix the anticoagulant. So inverting would be this. I'm going to do it 8 to 10 times. Okay. Patient preparation, none. Handling and storage, store at room temperature for up to 24 hours following collection. Causes for rejection. Reference range, which just means that this report will give you a reference range. Use, it tells us the use of it. Limitations and the methodology. All right, any questions on that? All right, very good. Lily, can you please read the first paragraph for assemble the equipment and supplies?
Use only the appropriate blood tubes as specified on the laboratory directory or manufacturer's instructions accompanying a test system. Substituting blood tubes may not yield the proper type of specimen required or may affect the test results, as shown by the following example. If serum is required and a tube containing an anticoagulant is used instead of a tube without an anticoagulant, the blood separates into plasma and cells rather than serum and cells, and the wrong type of blood specimen is obtained, which necessitates obtaining another specimen for the patient.
Very good. So in the first paragraph, I want you to highlight where it says, I'm sorry, guys, substituting blood tubes may not yield the proper type of specimen required or may affect the test results, as shown by the following examples. All right. Natalie, please go ahead and read the next paragraph.
The medical assistant should check each blood tube before use to ensure that it is not broken, chipped, cracked, or otherwise damaged. The damaged blood tubes are unsuitable for specimen collection and should be discarded. Blood tubes have an expiration date, figure 17.3. The medical assistant should make sure to check the expiration date on the tube to avoid using an outdated blood tube.
Very good. In the second paragraph, I want you ladies to highlight the first sentence and the last sentence. All right. Talia, can you go ahead and do you mind reading the rest of that? The last paragraph? That was quite a bit.
Can I skip this one?
Yes, ma'am. Not a
Thank you.
problem. All right. The medical assistant must be sure to label each blood tube. Highlight that sentence. An unlabeled specimen is a cause for rejection of the specimen by an outside laboratory. 2 unique identifiers should be used to label the specimen. Highlight that sentence. A unique identifier is the information that clearly identifies a specific patient, such as the patient's name and date of birth. A specimen can be labeled by attaching a computerized barcode to the specimen, figure 17.4a. The barcode label includes at least 2 unique patient identifiers. A specimen can also be labeled by handwriting the information on the label, which should include the patient's name and date of birth, 2 unique identifiers, the date and time of collection, the medical assistant's initials, and any other information required by the laboratory. Figure 17.4b. This information should be printed legibly, and the medical assistant should be certain that the information is accurate to avoid a mix-up of specimens. The medical assistant must also complete a laboratory request form to accompany the blood specimen. Note, the medical assistant should follow the medical office policy as to when the tube should be labeled. Some offices prefer the tubes labeled before the specimen is drawn. Other offices want the tubes to be labeled right after the specimen has been obtained. So let's go ahead and look at figure 17.3 and 17.4. And then you can convert, for 17.3, it shows the expiration date. And if you look on your tubes, you're going to be able to see the expiration date as well. Does everyone see that? All right, now let's look at figure 17.4. So A is the computerized barcodes. Most offices are doing this, however, not all of them are. And usually you'll input, this is when you are working with an EMR, you'll input the patient's information and your testing into the system, and the barcode labels will already kind of print off for you, and then you just place them on the bottles. Okay, now if your office doesn't do that, then we're going to look at B. So B has the patient's date of birth, last name, first name, the date the specimen was drawn, and the medical assistant's initials that drew the specimen. All right, that's kind of what that looks like. All right, reassuring the patient. Jasmine, can you go ahead and read that, please?
Venipuncture is often a frightening experience for the patient. For many patients, the anticipation of the procedure is worse than the actual drawing of the blood. The medical assistant should take time to explain the procedure to the patient in an unhurried and confident manner. This helps to alleviate the patient's fears, which relaxes the patient's veins. Relaxed veins make venipuncture easier to perform and result in less pain for the patient. Instruct the patient to remain still during the procedure. Explain to the patient that a small amount of pain is associated with the venipuncture, but it is brief. Never tell the patient that the venipuncture will not hurt. Just before inserting the needle, tell the patient that he or she will feel a small stick. This prevents startling the patient, which would cause the patient to move. Movement causes pain for the patient and it may damage the venipuncture site. You're still on mute.
I am on mute. Thank you. Okay, so you're going to highlight the in the second paragraph where it says never tell the patient that the venipuncture will not hurt. Just before inserting the needle, tell the patient that he or she will feel a small stick. Now, where have we heard this before, right? I think we've heard that never tell the patient that it won't hurt. Does anybody remember where we heard that before?
The pediatric.
Yeah, pediatrics. So it's going to be the same thing. You know, we always need to be as honest as we can with our patients. Very good. Thank you. All right, patient position for venipuncture. The patient position for venipuncture is especially important to the successful collection of a blood specimen. Proper positioning allows easy access to the vein and is more comfortable for the patient. The patient position depends on the vein to be used. The most common site for venipuncture is the antecubital space, and the information presented next refers to this site. The patient should be seated comfortably in a chair. Go ahead and highlight that, please. The arm should be extended downward to form a straight line from the shoulder to the wrist with the palm facing up. The arm should not bend at the elbow. The arm should be well supported on an armrest by a roll of towel or by having the patient place the first of the other hand under the elbow, figure 17.5. A venipuncture should never be performed with the patient sitting on a stool or standing. The patient may faint and injure himself or herself. If the patient appears nervous or has fainted in the past from a venipuncture, it is best to place the patient in a semi-reclining position, semi-Fowler position, on the examining table. Highlight those two sentences. A pillow or a cushion should be placed under the patient's arm to support the arm in a straight line from the shoulder to the wrist. Although unusual, it is possible for blood to flow from the evacuated tube back into the patient's vein during the procedure. This condition is known as venous reflux. Highlight those two sentences. Venous reflux could cause the patient to have an adverse reaction to a tube additive, particularly if the additive in the tube is the erythrodimerturic acid, the EDTA. Venous reflux can occur only if the contents of the evacuated tube are in contact with the tube stopper while the specimen is being drawn. Venous reflux is prevented by keeping the patient's arm in a downward position so that the evacuated tube remains below the venipuncture site and fills from the bottom up. So you're going to highlight the first two sentences and the last sentence. So we're going to go ahead and take a look at figure 17.5. And I want all of you, Nancy, we're on page 622. I want all of you ladies to go and practice this, right? So the patient's arm is like this. And right now, the medical assistant has their arm here, probably to review the antecubital space. Again, this is the most common site used. And then just practice having your other hand go underneath your arm. And if you allow your arm to relax, your arm should be already in a downward position. Okay? Any questions on that? Okay. Application of the tourniquet. An important step in the venipuncture procedure is the application of the tourniquet. The tourniquet makes the patient's veins stand out so they are easier to palpate. The tourniquet acts as a dam that causes the venous blood to slow down and pool in the veins in front of the tourniquet. This pooling of blood makes the veins more prominent so that they are more visible and can be palpated. Highlight those 3 sentences. When applying a tourniquet, it is important to obtain the correct tourniquet tension. The tourniquet should be applied with enough tension to slow the venous flow without affecting the arterial flow. A tourniquet that is too tight obstructs both venous blood flow and arterial flow, which may result in a specimen that produces inaccurate test results. Highlight that sentence. A tourniquet that is too loose fails to cause the veins to stand out enough to be palpated. A correctly applied tourniquet should fit snugly and not pinch the patient's skin. Okay, so does everyone know what palpate means? If I were to say palpate, what does that mean that I'm doing? Lightly tap. Yeah, pretty much. That's right. Okay, so I want everyone to either look on the back of your hand or maybe even on the top of your feet, right? Top of my foot. There's my foot. Okay. Now, most probably you're going to be able to see a vein, right? I want you to, with your index finger, I want you to lightly palpate that vein that you see. I want you to get a sensation of that feeling of what a vein feels. And I want each of you to describe what you feel. I want you to look for a nice vein either on the back of your hands or on the top of your feet. And I want you to palpate that and describe what you feel. Find a vein and palpate it, and then tell me what you think it feels like. Very good. So Natalie said squishy, and I felt my vein pop out a little bit. Yeah, it's kind of squishy, almost kind of like a spongy feeling, right? What about everybody else? What do they think? What do you think it feels like? All right, Lily, try to look on your arm, like look in your antecubital space. Do you see your veins don't pop out? Okay. Well, go ahead and still feel in the antecubital space, right? So I'm going to take my finger and I'm going to feel, and you're going to kind of feel something spongy, something squishy, and it kind of bounces back a little bit when you palpate it. What does everyone else feel? Okay, Natalie, thank you. Jasmine, what do you feel? Do you feel anything?
I can't ever find it. I'm that one person that everyone has trouble getting blood out of.
Oh, I can't wait till we get to the clinic. All right, not a problem. Anybody else? And don't worry, we're going to go over this again when we get, yeah, actually, it's kind of weird. It's squishy, right? Yeah, we're going to be going over this when we get in the clinic. Okay, so the reason I want you ladies to try to feel, and again, if you can't, that's fine. We're gonna do this again when we get in the clinic. Is because the one thing when you're doing phlebotomy, when you're doing venipuncture, is you don't go by what you see, you go by what you feel. But you have to be able to know what that feeling is, right? And this is the best way to do it, is to find veins and just, I mean, anywhere. If you got a big vein in your neck, try to find it and just feel it. I got one right there. It's kind of squishy, spongy. And that way you get the sensation of what it feels like. Because again, you don't go by what you see, you go by what you feel. All right, very good. All right, so now the guidelines for applying the tourniquet. Now we're going to review the guidelines, and then I'm going to have you guys look at the figure 17.6, and then I'm going to kind of tell you a little bit on how you can start practicing at home. Okay? Let's see here. Jasmine, can you go ahead and read 1, 2, and 3, please?
Do not apply the tourniquet over sores or burned skin. 2. Place the tourniquet 3 to 4 inches above the bend in the elbow. This allows adequate room for cleansing the site and performing the venipuncture without the tourniquet getting in the way. 3. Apply the tourniquet so it is snug but not so tight that it pinches the patient's skin or is otherwise painful to the patient.
All right, very good. So you ladies are going to highlight the first sentence in number 2 and all of number 3. And then I want you to imagine 3 to 4 inches above the elbow. So this is my elbow, okay? Try to see where I can see. 1, 2, 3. So this area is where I'm going to apply my tourniquet, okay? All right, Lily, can you please read 4 and 5, please?
When applying the tourniquet, ask the patient to clench his or her fist. This pushes blood from the lower arm into the vein and makes them easier to palpate. You can ask the patient to clench and unclench the fist a few times. However, vigorous pumping should be avoided because it could lead to hemoconcentration, which could produce inaccurate test results. Never leave the tourniquet on for longer than 1 minute, because this would be uncomfortable for the patient. In addition, prolonged application of the tourniquet causes the venous blood to stagnate or pool in one place too long, a condition known as venous stasis. When venous stasis occurs, the plasma portion of the blood filters into the tissue, causing hemoconcentration. Hemoconcentration is an increase in the concentration of non-filterable blood in the blood vessels, such as red blood cells, enzymes, irons, and calcium, as a result of a decrease in the blood content of blood. This can result in inaccurate results for a variety of the laboratory tests.
Very good, thank you. Okay, so for 4, you're going to highlight where it says ask the patient to clench his or her fist. And on 5, I want you to highlight where it says never leave the tourniquet on for longer than 1 minute. So generally, when I am approaching my patient and I've already gathered my supplies, I've done everything, I'm about ready to do a venipuncture. Before I apply the tourniquet, I'll go ahead and review my canvas, right? I'm going to palpate the patient's antecubital space on both arms. I may even view the back of their hands just to kind of see where I can obtain my specimen. Once I feel like I found a really good vein, then I apply my tourniquet, right? I've already got everything done. I've got all my supplies. I'm ready to perform my venipuncture. So I'm going to apply my tourniquet. I cleanse my area, perform my venipuncture, and then undo my tourniquet and pull out of the antecubital space with my needle. Now, if you apply the tourniquet and you're just not quite confident in that vein, not a problem. Go ahead and undo the tourniquet, okay? And then look and review your canvas again. All right. Nancy, will you please read 6 and 7?
To remove the tourniquet as soon as a good blood flow is established. However, this may not be practical when you are first learning the venipuncture procedure. Removing a tourniquet may cause the needle to move such that no more blood can be obtained and the blood has to be redrawn. When you are learning the venipuncture procedure, it is better to wait until just before the needle is removed to remove the tourniquet. Always remove the tourniquet before removing the needle from the patient's arm. If the needle is removed first, the pressure of the tourniquet causes blood to be forced out of the puncture site and into the surrounding tissue, resulting in hematoma. A hematoma is defined as a swelling or mass of coagulated blood caused by a break in a blood vessel.
Very good. Okay, so number 6, you're going to highlight where it says you should remove the tourniquet as soon as a good blood flow is established. And then on number 7, highlight always remove the tourniquet before removing the needle from the patient's arm. Okay, so again, I'm in the antecubital space, obtaining blood, my tourniquet's on. Before I withdraw my needle, or as soon as I see that I'm getting really good blood flow in my tube, I'm going to go ahead and undo my tourniquet. Okay. Now imagine if you have the tourniquet on, right? Like you have something if you have a water balloon and a needle is in the water balloon, all right? If you don't release the pressure when you pull out that needle, what is going to happen?
You said if we have a water balloon
Mm-hmm.
and what?
And if I have a water balloon and there's a needle inside my water balloon, okay,
Uh-huh.
if I don't release that water from somewhere else and I pull out my needle, what do you think is going to happen?
The water's going
Water is going
to
to come up with pressure.
Yep, exactly. Same thing is going to happen if you withdraw your needle before undoing the tourniquet. It's like water. Blood is just going to start pouring out because of that pressure, right? Because again, that tourniquet holds a pull of the blood in the veins. So if you pull out, then blood's just going to start coming through another hole, right? It's going to start coming through the way, and it's going to cause a big mess, and a hematoma is going to form. Okay?
Okay.
Number 8. After use, wipe a tourniquet thoroughly with a disinfectant such as alcohol. Highlight that sentence. Disposable tourniquets are available that are thrown away after one use. Okay? So now I want to go and take a look at figure 17.6. So this is the application of a tourniquet. So A is create tension by pulling the ends of the tourniquet away from each other, right? So I'm going to pull them up, honestly. B, with tension, cross one flap over the other at a point of your grasp. So I'm going to bring it to here. C, form a loop by tucking a portion of the top length into the bottom length. All right, so the best way to practice this, and you can go ahead and start doing it today, find a tennis shoestring. Maybe you don't need to wear your shoes today. Take one of those shoestrings. Okay, just like, imagine if you're tying your shoe, right? You got the two bunny ears and you pull through and you pull all the way through. The difference is in the tourniquet is you're not going to pull all the way through. I want you to partially tuck one end and leave it alone. The next part I want you to do is I want you to take one end of your shoestring and I want you to pull it. You should be able to release your shoestring. just like you would with the tourniquet. You're going to be able to release the tourniquet with one hand in one area. Okay, does that make sense? If not, that's fine. I'll show you. Do y'all want me to show you, or is everyone good?
I'm good.
Good. Okay, Nancy. Thank you. Okay. So I want you guys to practice that. You can practice it every day. Once at the clinic, the lady taking blood, let the tourniquet go after trying it, and it hurt. Natalie, explain that. Let the tourniquet go after.
I mean, after after tucking in everything, like she did it in a weird way. Like I don't think it was this way, but she just like tied it and like she just let it go like a rubber band when you pull it from your wrist and you let it go. She did that and it hurt.
Yeah. So the way that I do it is exactly like it is in figure 17.6, and that's the way I'm going to show you. However, everybody has their own technique, but you have to be able to undo the tourniquet with one hand, right? Because your other hand is still in the vein obtaining blood. So you have to be able to do it with one hand. And then you also want to be able to undo it without causing the patient pain. So we'll continue to work on this technique, but most of the time, this is pretty much the way. It's probably just the way that person did the tourniquet. But it's really good if you can go and start practicing getting your technique down now. And then that way, once we get in the clinic, you've already got that pretty much down and we can review that.
I think you had someone on here that wanted you to show them.
One more time, Nancy, what was that?
I think Lilia Barajas said that she wanted you to show her.
Okay. All right. Hold on a second. Let me go get some supplies and I'll show you guys, okay?
Okay.
Okay. So I'm borrowing my youngest kid for this, right? Hi. Okay. So I've got a shoestring. Right. Okay. So this is my tourniquet. I'm going to pull it up. I'm going to cross it at a point. Hold on. Shoestring's too long. Okay. So I'm going to cross it at, okay. So I'm going to pull my tourniquet up, cross it once, right? Does everybody see a crisscross? And then with my right hand, I'm going to tuck it just like I'm going to tie my shoe, but I'm only tucking it halfway to where you have a tail. I'm going to usually be flexible. Tail. Okay, so then when I'm in the arm, I can undo this flap and my tourniquet comes off. Does everybody see that? Understand that? I can do it several times. Amy doesn't mind. Okay. Anybody else? Because if, like I said, we're going to go over this tons and tons of times in the clinic, but I really want you guys to be able to practice at home. Okay, good. Does anybody else not have it?
So when you untie that little part that you tucked in like halfway, do you just pull it and it just comes undone? All of
Yeah.
it?
Yep. Yep. So I crisscross, right? Like I'm going to tie my shoe. I go ahead and take my loop. I'm going to go in. But again, I'm only tucking it halfway. And then that one that's tucked, right? When you undo it, it automatically comes loose. Oh, no, 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 Lily. You don't know. Lord, I wouldn't even want to try doing that one-handed. No, you'll need both hands for that. But when you take it off, you have to be able to use the one hand. But applying it, you'll use both hands. All right, any questions on that? Okay, all right. Thanks, Amy. Okay, so with our tourniquets, we have a couple of types of tourniquets. Now, most offices, you probably will see both. You'll see rubber tourniquets and disposable tourniquets. So it'll just depend on your office, but we're going to go over the types of tourniquets. The most common tourniquets are the rubber tourniquet and the Velcro closure tourniquet. The type of tourniquet used is a matter of individual preference. So again, there's no wrong way. So the first one is the rubber tourniquet. The rubber tourniquet consists of a flat, soft band of rubber, approximately 1 inch wide and 15 to 18 inches long. Rubber tourniquets are commercially available in latex and non-latex rubber. They offer the advantage of being easily removable with one hand. The technique for applying a rubber technique is described next and illustrated in figure 17.6. So the tourniquet that's in figure 7, that's a rubber tourniquet. Now in the clinic, I will be able to show you the Velcro, but it's not as common, not as commonly used as the rubber. All right. Now I want you guys, let's go on to page 624. Now in figure 17.7, this is the Velcro tourniquet. The Velcro closure tourniquet consists of a band of rubber or elastic material with Velcro attached at the ends. This type of tourniquet is easier to apply and is more comfortable for the patient than the rubber tourniquet. The disadvantage of the Velcro closure is that it is more difficult to remove with one hand than the rubber tourniquet. In addition, this type of tourniquet may not fit around the arms of extremely obese patients. The technique for applying the Velcro closure tourniquet is described next and illustrated in figure 17.7. All right. Now, before we start on site selection for venipuncture, let's go ahead and look at figure 17.8. So these are the antecubital veins. You have your cephalic vein, basalic vein, median cubital vein, median basalic vein, supplemental cephalic vein, and median antebrachial vein. What do you guys would think would be the most common vein used?
The median basilic vein.
Possibly, yep. What would be another one?
Or the median cubital vein.
The median cubital vein, yep. Very good. Okay. So now let's go ahead and start with the site selection for venipuncture. Let's see here. Natalie, can you go ahead and read the first and second paragraph for site selection for venipuncture?
For most patients, the best site to use is the veins in the antecubital space. Figure 17.8. If the patient has large visible antecubital veins, drawing blood is easy. If the patient has small veins or veins that cannot be palpated, obtaining a blood specimen can be quite a challenge even for the most experienced medical assistant. The antecubital space is the surface of the arm in front of the elbow. The antecubital veins typically have a wide lumen in the skin, which makes them easily accessible. In addition, these veins typically have thick walls, making them less likely to collapse. Using the antecubital space spares the patient unnecessary pain because the skin is less sensitive there than at the other side, such as the back of the hand. The medical assistant should not be misled by the presence in some of the patients of many small, very blue, spidery veins that lie close to the surface of the skin. These veins are not suitable for performing a venipuncture. The antecubital veins lie beneath these veins.
Thank you, Natalie. I'm sorry about that. So you'll be able to feel this. You'll be able to feel the difference between these spidery veins and non-spidery veins. All right. Sabrina, are you where you can read the next two paragraphs?
Yes. Where are we exactly?
Where it says the best vein to use
Okay.
in the yep.
The best vein to use in antecubital space is the median cubital. The median cubital is a prominent vein in the middle of the antecubital space and does not roll. At times, however, the median cubital vein cannot be used. For example, when it lies deep in the tissues and cannot be palpated or is scarred from the repeated venipunctures. The cephalic and basilic veins are located on opposite sides of antecubital space and provide alternative site when the median cubital vein is unavailable. The cephalic vein is located on the thumb side of the antecubital space, and the basilic vein is located on the little finger side of the antecubital space. The disadvantage of the side veins is that they tend to roll or move away from the needle, escaping puncture. To prevent rolling, firm pressure should be applied below and to the side of the vein to stabilize it as the needle is inserted.
Okay. So I want you guys to highlight that very first sentence where it says the best vein to use is in the antecubital space is the median cubital. All right, Jasmine, can you go ahead and read the next paragraph, please?
The brachial artery also is located in the antecubital space, but it lies deeper in the tissues. This is the artery that is used to measure blood pressure. Before performing a venipuncture, palpate for the presence of this artery. In contrast to a vein, an artery pulsate is more elastic and has a thicker wall than a vein. If the brachial artery is inadvertently punctured, the patient feels more than the usual amount of pain, and the blood is red and comes out in pulsing movements. If this situation occurs, the tourniquet should be removed and then the needle. Pressure with the gauze pad should be applied for 4 to 5 minutes.
Okay. So I want you ladies to highlight where it says an artery pulsates, is more elastic, and has a thicker wall than a vein. If the brachial artery is inadvertently punctured, the patient feels more than the usual amount of pain, and the blood is bright red and comes out in pulsing movements. If this situation occurs, the tourniquet should be removed and then the needle. Pressure with a gauze pad should be applied for 4 to 5 minutes. All right, guidelines for site selection. Nancy, can you please read 1, 2, and 3?
Ensure that the lighting is adequate. Good lighting facilitates inspection of the veins. Ensure that the veins stand out as much as possible. Before locating a venipuncture site, always apply the tourniquet and then have the patient make a fist. The first combination makes the veins more prominent. Examine the antecubical vein of both arms. The best site to perform the venipuncture varies with each individual. The patient may have larger veins in one arm and than in the other. It is advisable to ask the patient whether he or she has had a venipuncture before. Most adults have had previous venipunctures and know which of their veins are best to use and which should be avoided. Listen to and evaluate information offered by the patient.
Very good. Thank you. Okay, I want on number 2, I want you ladies to highlight that ensure the veins stand out as much as possible. And then on number 3, highlight examine the antecubital veins of both arms. Now, so is it okay for us to ask our patients, have they had venipuncture done before?
Blood drawn.
Yes. So they've had a venipuncture done before. Now, is it okay to ask them where? Yes. Yes, it is. Now, that doesn't mean you're going to go there, but you can at least feel of what the previous medical assistant, nurse, lab tech used, right? And then you can still make a decision at that point if you still want a vein, if you still want to obtain a specimen from that vein. Now, if a patient has just previously, like maybe within a week, had their blood drawn from that vein, I don't know if I would use that vein. I certainly wouldn't go in the exact same area. You might can go a little bit above or a little bit below that area. All right, any questions on that? Okay. Use inspection and particularly palpation to select a vein. A vein does not have to be seen to be a good selection. Highlight that sentence. If you cannot see a vein, palpation alone can be used to locate it. A vein feels like an elastic tube that gives under pressure of the fingertips. So again, you want to palpate the vein, but again, you don't want to go by what you see. You want to go by what you feel, right? I always kind of look away, right? Because sometimes the eyes can play little tricks on you. Like you think you see a good vein, maybe you don't feel a good vein. And most of the time, for me, anyways, it wasn't a good vein. So I always go by what I feel more than what I see. All right, Natalie, please read number 5.
Always palpate the median cubital vein, middle vein first. It is usually is bigger and it is anchored better, bruises less, and poses the smallest risk for injuring underlying structures. Examples: nerves and arteries than the other veins. Because of this, if the patient's median cubital vein cannot be seen but still can be palpated, it should be used as the first choice when selecting a vein. If the median cubital vein is good in both arms, select the one that appears the fullest. The cephalic vein, located on the thumb side, is the next best vein choice. It does not roll and bruise as easily as the basilic vein. The basilic vein, located on the little finger side of the antecubital vein, antecubital space, it is the least desirable venipuncture site in the antecubital space. The branches of the median nerve may lie close to this vein in some individuals. In addition, the basilic vein lies in the close proximity to the brachial artery. Both of these conditions pose a risk of the injury to underlying structures when the blood is drawn from the basilic vein.
Very good, thank you. Okay, so number 5, you're going to highlight where it says it usually is bigger, is anchored better, bruises less, and poses the smallest risk of injuring underlying structure. All right, Sabrina, can you please read 6?
Thoroughly assess the patient's veins. To assess the vein as possible site for venipuncture, place 1 or 2 fingertips, index and middle fingers, over it and press lightly, then release pressure. do not use your thumb or palpate the vein because it is not as sensitive as the index finger. To be suitable for venipuncture, the vein should feel round, firm, elastic, and engorged. When you depress and release an engorged vein, it should spring back in a rounded, filled state.
Very good. So on number 6, you're going to highlight where it says place 1 or 2 fingertips, your index and middle fingers, over it, press lightly, and then release pressure. Also highlight, do not use your thumb to palpate the vein because it is not as sensitive as the index finger. All right, Talia, can you read 7, please?
Determine the size, depth, and direction of the vein. When a suitable vein has been located, it should be palpated thoroughly and carefully to determine the direction of the vein and to estimate the size and depth of the vein. Palpate and trace the path of the vein several times by rolling your index fingers back and forward over the vein to determine its size. Inspect and palpate the vein for problems. Some veins that appear suitable at first sight feel small, hard, bumpy, or flat when palpated.
Very good. Jasmine, please read number 8.
Map the location of the site. After locating an acceptable vein, mentally map the location of the puncture site on the patient's arm with skin marks. This technique is particularly helpful if the vein cannot be seen but only palpated. The puncture site may be located on or next to a skin mark, such as a freckle, a small wrinkle, or a pigmented area.
Very good. All right, you're going to highlight where it says map the location and highlight skin marks. All right, Lily, please read number 9.
Do not leave the tourniquet on for longer than 1 minute. When first learning the venipuncture procedure, you may need to perform numerous assessments of the patient's arm to locate the best vein. After each assessment, remove the tourniquet for approximately 2 minutes to allow normal circulation of the blood to occur. This prevents patient discomfort and hemoconcentration, which can lead to inaccurate results for a variety of laboratory tests.
Very good. On number 9, you're just going to highlight the first sentence. All right, Nancy, can you go ahead and finish with 10, please?
If a good vein cannot be found, the following techniques can be employed to make the veins more prominent. Remove the tourniquet and have the patient dangle the arm over the side of the chair for 1 or 2 minutes. Tap the vein site sharply a few times with your index finger and second finger. Gently massage the arm from the wrist to the elbow. Apply a warm, moist washcloth to the area for 5 minutes.
Very good, thank you. All right, so on number 10, you're going to highlight each bullet point. All right, any questions on that before we go to alternative venipuncture sites?
No, ma'am.
All right, thank you. All right, alternative venipuncture site. If it is possible to locate a suitable vein in the antecubital space, if it is impossible, alternative sites are available, including the inner forearm, the wrist area above the thumb, and the back of the hand. These alternative veins are smaller and have thinner walls than the antecubital veins and should be used for venipuncture only when all possibilities of obtaining the blood specimen and the antecubital space have been considered. If the medical assistant is able to palpate a small vein in the antecubital space, it may be possible to obtain blood there using the butterfly method of venipuncture. Highlight the first sentence in this paragraph. The hand veins in particular should be used only as a last resort. The veins of the hand have a tendency to roll because they are not supported by much tissue and are close to the surface of the skin. This makes them more difficult to stick. In addition, an abundant supply of nerves is present in the hands, which makes this procedure more uncomfortable for the patient. Hand veins tend to have thin walls, which makes them more susceptible to collapsing, bruising, and phlebitis. In some patients, however, especially the obese and the elderly, the hand veins may be the only acceptable site. You're actually going to highlight all of the second paragraph. All right, so let's go ahead and take a look at figure 17.9. So the wrist area, the inner forearm, and then if we look on the back of the hand, you can kind of see how the veins are mapped out. Types of blood specimens. The type of blood specimen required depends on the type of test to be performed. Serum is required for most blood chemistry studies, whereas whole blood is required for CBC. The various type of blood specimens that a medical assistant should be required to obtain through the venipuncture procedure are as follows. Number 1, clotted blood. Clotted blood is obtained from a tube that does not contain an anticoagulant. Highlight those two sentences. A tube without an anticoagulant causes the blood cells to clot. 2, serum. Serum is obtained from clotted blood by allowing the specimen to stand and then centrifuging it. Highlight those two sentences. Centrifuging a blood specimen that does not contain an anticoagulant causes the blood to separate into the following layers. Top layer, which is your serum, the bottom layer, which is your clotted blood cells. You're going to highlight the first two sentences and where it says serum and clotted blood cells. Number 3, whole blood. Whole blood is obtained by using a tube that contains an anticoagulant. Highlight those two sentences. An anticoagulant is a substance that inhibits blood clotting. It is important to mix the anticoagulant with the blood by gently inverting the tube back and forth 8 to 10 times after collection. All right, ladies, which tube would this be? Could it be?
What's the question?
Which tube would be considered to have an anticoagulant in it?
The
We just don't
lavender.
know. Which one?
The lavender one?
Yes, very good. The lavender one. Good. All right, number 4, plasma. Plasma is obtained from whole blood that has been centrifuged. Highlight those two sentences. Centrifuging a blood specimen that contains an anticoagulant causes the blood to separate into the following layers. The top layer, plasma, highlight that word. The middle layer, the buffy coat, highlight those two words, contains the white blood cells and platelets. And the bottom layer, which is our red blood cells, highlight those 3 words. All right, let's go ahead and look at figure 17.10 on page 626. So A is has no anticoagulant and B has an anticoagulant. Highlight the word serum, cells, plasma, buffy coat, no anticoagulant, and highlight that layers into which the blood separates when there is no anticoagulant and when an anticoagulant is present. All right, any questions on that? Okay. OSHA safety precautions. Let's see here. Jasmine, can you read 1, 2, and 3, please?
Do I read that little?
You can if you want.
The OSHA bloodborne pathogen standard presented in Chapter 2 must be carefully followed during the venipuncture procedure to avoid exposure to bloodborne pathogens. The following OSHA requirements apply specifically to the venipuncture procedure and to separation of serum from whole blood. 1. Wear gloves when it is reasonably anticipated that you will have hand contact with blood. 2. Avoid hand-to-mouth contact, such as eating, drinking, or applying makeup while working with blood specimens. 3. Wear a face shield or mask in combination with an eye protection device whenever splashes, spray, splatter, or droplets of blood may be generated.
Very good. Lily, can you please read 4, 5, and 6?
Did you say 3, 4, 5, and 6?
4, 5, and 6.
Oh. Perform all procedures involving blood in a manner so as to minimize splashing, spraying, or splattering, and generating droplets of blood. Bandage cuts and other lesions on the hand before gloving. Sanitize hands as soon as possible after removing gloves.
All right. Nancy, can you please read 7, 8, and 9?
If your hands or other skin surfaces come in contact with blood, wash the area as soon as possible with soap and water. If your mucous membrane, example eyes, nose, mouth, comes in contact with blood, flush them with the water as soon as possible. Do not bend, break, or share contaminated venipuncture needles.
Very good, thank you. Natalie, can you please read 10, 11, and 12?
Do not reach a contaminated venipuncture needle. Locate the sharps container as close as possible to the area of use. Immediately after use, place the contaminated venipuncture needle and plastic holder in the biohazard sharps container. Place specimens in containers that prevent leakage during collection, handling, processing, storage, and transport and shipping.
Very good. Okay, so you ladies are going to highlight 10 and 11. Sabrina, can you please read 13, 14, and 15?
Handle all laboratory equipment and supplies properly with care as indicated by the manufacturer. For example, wait until the centrifuge comes to a complete stop before opening it. Do not store food in refrigerators where testing supplies or specimens are stored. If you are exposed to blood, report the incident immediately to your provider or employer.
All right, very good. All right, case study number 1. Angela Castillo is 21 years old and comes to the office at 9 a.m. to have her blood drawn for a CBC and a thyroid profile. She has brought a friend along with her. Angela seems nervous and her voice is shaking. She says this is her first venipuncture she has ever had. Angela asks whether her friend can stay with her to give her moral support while her blood is being drawn. Angela says that the blood has to be taken out of her left arm. She says she is right-handed and has a softball game this evening. When the veins of Angela's left arm are examined, a suitable vein cannot be located. However, she has a good median cubital vein in her right arm. Angela then wants to know whether the blood could be drawn from her left hand like they do on the hospital television shows. All right, so what do we do?
Well, I guess first of all, we can ease her concerns as far as her being nervous. Just let her know what to expect.
Very good.
As far as the her wanting us to draw her blood from a specific site, I want to say, I could be wrong, but I think we have to go with, I guess, what, as a medical assistant, what we feel is more, what we're more comfortable with. If we see that we found a good vein, and that's all we can get at this point, then we have to go with what we have.
Very good.
And
Very
explain
good.
that to her.
Yes. Good. Now, because we definitely probably are going to want to do the right arm what do we inform the patient because she says she has a softball game that night?
I mean, we can let her know, I guess, what she needs to do as far as once we're done. I guess it aren't they supposed to like I'm trying to remember. Once we draw her blood and we bandage it, are we supposed to put pressure on it for a little bit?
Yeah, generally,
And I think she can use it after what? A couple of hours or 24 hours. Like, I don't think it'll affect her game.
right, it shouldn't. So she's getting her lab work done at 9 in the morning. She probably can take the dressing off within, 5 to 10 minutes maybe, and her arm should be fine for her to use for her softball game.
Okay,
Which
yeah.
shouldn't be a problem at all. Very good. Okay, now she's nervous, right? And we're kind of instructing her on, what's going to happen. But if she's nervous, how do we need to place our patient? Do we just have her sit or
Lay down?
yeah, lay down, or even in a semi-fallow, right, where she's at least her back is up against something
Yes.
and her legs are propped out. Yeah, very good. All right, good. Is there anything else that we would do?
I say we could allow her friend to sit in for, as moral support.
Yep. Very good. Yep, that's right. It's not going to be a problem at all. All right, what do we not want to do?
Oh, we definitely don't want to just do what she's asking us to do.
Right.
I don't want to freak her out any more than she already is.
Right. Yeah, we don't want to cause, she's already nervous, right? We don't want to make that worse. Good. All right, good job, ladies. All right, any questions up to this point?
I don't think so.
Okay. All right, good. All right, so the vacuum tube method of venipuncture. The vacuum tube method is frequently used to collect venous blood specimens. This method is considered ideal for collecting blood from normal, healthy antecubital veins that are adequate in size to withstand the pressure of the vacuum in the evacuated tube. Procedure 17.1 outlines the venipuncture vacuum tube method. The vacuum tube system consists of a collection needle, a plastic holder, and an evacuated tube. One commercially available vacuum tube system is the Vacutainer system. All right, let's go ahead and take a quick look at figure 17.11. All right, so this is our evacuated tube, rubber stopper. This is a flange. And then this is going to be our needle. One side is the posterior side, which is going to go in here, like so. And then this is our anterior side. This is what's actually going to go into the skin in the vein. Okay. All right, let's go on over to page 628. Let's go ahead and take a quick look at figure 17.12. So the vacuum tube needle in its container showing the gauge and size of the needle. The gauge of the needle is 21 gauge and the size of the needle is 21 inch. So just like with our previous needles, right, we have our gauge and then we have how long our needle is. Now, there are a couple of different variety of sizes of our vacuum tube needles, but 21 and 18 gauge are usually the most common. So this is a 21 gauge, just like it's shown in the picture. Okay. All right, needle. Let's see here. Talia, can you read the first paragraph under needle? Right. Jasmine, can you read the first paragraph, please?
The needle used with the vacuum tube method consists of a double-pointed stainless steel needle with a threaded hub near its center. Figure 17.12. The needle is coated with silicone, enabling it to penetrate the skin smoothly. The threaded hub of the needle screws into the plastic holder. Vacuum tube needles are packaged in sealed, twist-apart plastic containers. The needle gauge and length are printed on the paper seal on the container. A needle should not be used if the seal has been broken.
All right, very good. So in the middle, that's what we're going to consider our seal, right? So you can't see it real well. I'm gonna try to. So this seal is not broken, but in a moment I'm going to break it. Okay. All right. Lily, go ahead and read the next paragraph.
The double-pointed needle consists of an anterior needle and posterior needle. The anterior needle is longer and has a beveled point designed to facilitate entry into the skin and the vein. The posterior needle is shorter and is a rubber stopper of the evacuated tube. The posterior needle has a rubber sleeve and functions as a valve, pushing the tube stopper of an evacuated tube onto the posterior needle compresses its rubber sleeve and exposes the opening of the needle, allowing blood to enter the tube. When the tube is removed, the sleeve slides back over the needle, opening and stops the flow of blood.
All right, very good. Nancy, can you go and read the next paragraph, please?
The vacuum tube needles are available in sizes 20 gauge to 22 gauge with a 21, is it gauge or gauge?
Gauge.
Gauge. Needles used most often for routine venipuncture. A 22 gauge needle is recommended for children and adults with smaller veins, and a 20 gauge needle is sometimes used when a large volume tube is used to collect a blood specimen. Manufacturers often color code the needle guard and hub of venipuncture needles by gauge for easier identification. For example, Becton Dickinson uses this following color coding system: yellow for G gauge needles, green for 21 G gauge needles, and black for 22 gauge needles. Vacuum tube needles come in two lengths, 1 inch and 1.5 inches. The length used is based on individual preference. Most medical assistants prefer the 1 inch needle for routine venipunctures. A 1 inch needle is less intimidating to the patient and tends to offer greater control because it allows the medical assistant to to rest the fourth and fifth finger on the patient's arm for stability. A 1.5 inch needle allows more room for stabilizing the vein.
Very good. All right, so you're only going to highlight where it says the 21 gauge needles used most often for routine venipuncture. Safety engineered venipuncture devices. OSHA stipulates requirements to reduce needle stick and other sharp injuries among healthcare workers. As discussed in Chapter 2, employers are required to evaluate and implement commercially available safer medical devices that reduce occupational exposure to the lower extent feasible. Safer medical devices include safety engineered venipuncture devices. These devices incorporate a built-in safety feature to reduce the risk of a needle stick injury. Figure 17.13 illustrates a safety engineered venipuncture device and the method for using it. All right, so now again, I'm going to teach you guys to not use safety to know how, but this it would be a safety engineered venipuncture device. Okay. Plastic holder. A plastic holder consists of a plastic cylinder with two openings. The small opening is to secure the double-pointed needle, and the large opening is used to hold the evacuated tube. The larger opening has a plastic extension known as the flange, right? This is our flange inside. Tube. Flange. The flange assists in the insertion and removal of evacuated tubes and prevents the plastic holder from rolling when it is placed on a flat surface. The plastic holder has an indentation about a ½ inch from the hub of the needle. This marks the point at which the posterior needle starts to enter the rubber stopper of the tube. If a tube stopper is inserted past the point before the vein is entered, the tube fills with air, which prevents blood from entering the tube. Evacuated tubes. Evacuated tubes consist of a glass or plastic tube with either a rubber stopper or a Hemogard closure stopper. The tube contains a pre-measured vacuum that creates suction to pull the blood specimen into the tube. Evacuated tubes use a color-coded stopper system for ease in identifying the additive or no additive content of the tube. The additive content of evacuated tubes is described in the next section and illustrated in figure 17.14 and 17.15. A tube additive must not alter the blood components or affect the laboratory test to be performed. The color of the tube stopper used depends on the type of test to be performed. The medical assistant must determine the correct color of the stopper to use for each collection. The color-coded stopper tubes must not be substituted for one another because inaccurate test results could occur. If a CBC has been ordered by the provider, a lavender stopper tube must be used. A tube with a different colored stopper cannot be substituted for it. Evacuated tubes are available in varying capacities that range from 2 millimeters to 10 millimeters. The capacity of the tube used depends on the amount of specimen required for the test. Highlight those last two sentences. So this is a 4 millimeter tube, and this one is an 8.5 millimeter tube. If the medical assistant is working with an outside laboratory, information on the amount of specimen required for a laboratory test and the stoppered color of the tube required is indicated in the laboratory directory. If the test is being performed in the medical office, this information is indicated in the instructions accompanying the blood analyzer or testing kit. Information regarding additive content, expiration date, and tube capacity is on the label of each package of the evacuated tubes. See figure 17.16. In addition, evacuated tubes have a label affixed to them indicating the additive content, expiration date, and tube capacity, as well as a fill indicator to indicate when the vacuum has been exhausted and the tube is full. A Hemogard closure stopper consists of a special rubber stopper and a plastic closure that overhangs the outside of the tube. Together, these components act as a single unit to reduce the likelihood of coming in contact with the contents of the tube. After collecting a blood specimen, the medical assistant may need to gain access to the blood in the tube for testing or for further processing, such as in separating serum from whole blood. A conventional rubber stopper evacuated tube pops as the top is removed, which may result in splattering of blood. The design of the Hemogard stopper works to prevent splattering of blood when the top is removed. The color coding of Hemogard closure stoppers is similar to the rubber stopper tubes. Okay, so this is a Hemogard stopper. Okay, got my rubber on the inside, and then this opens if I need to. This is a rubber stopper tube, and it's a pain in the butt to get off, which causes more splatter of the blood. All right, so figure 17.14. So we have our red tube, no anticoagulant. I have our lavender, it's got our EDTA. We have a light blue. See if I have a green. I believe I do. Green tube. Okay, I don't have a gray or a dark blue, but this is a gold HemoGuard tube. Okay. Any questions so far?
Miss Daniel.
Yes,
So what is like the lavender one? That's like supposed to be for like CBC, right?
that's right.
Okay. So what does EDTA stand for?
EDTA. It is a super long word. Let me get back to it.
I guess as long as I know that it is for CBC. I just didn't know if EDTA stands for something else and it wasn't for CBC.
It is for CBC, but it is a substance. Let me get back to it because it's super hard to say.
Okay.
So let me get back to it because we just covered it not that long ago. Why can I not? Hold on, let me get it here. Okay, it's linea diamimetic acetic acid.
Okay. Thank you.
You're welcome. I'm gonna spell it because it's like super long word. Okay, I just sent it to you.
Thank you.
You're welcome. All right, any other questions?
So from what I'm looking at, I think we're about to go over what each color tube is, right?
Yes.
Okay, so I guess I'll just hold my questions off till then.
Yeah, that's fine. Yeah, so now we're going to start getting into, because that's a common one. Like for some, they may already know that our lavender tube is probably what we're going to use for CBC, right? Some, not everybody may, and that's fine. But some of these other tests, it's like they're really common tests, but we're not familiar with maybe what that color tube looks like, right? And we're about to go over that.
Okay.
All right. Good. All right, so the additive content of the evacuated tubes, right? Because some tubes have something and some don't, right? We need to know what that purpose is for. So our red stopper tube does not contain an anticoagulant. Highlight that. And are used to obtain clotted blood or serum. Serum is required for serologic tests and most blood chemistries. two are red speckled tube, often called a tiger top. This is a super common. Oh, I gotta get the cat back on so you can see it. All right, let me see if you can. Do you see it now? This is considered a tiger top. These two different colors. Okay. So highlight that it's often called a tiger top. The tube has a gold stopper if Hemogard tubes are used, which is this one, the gold. And you can see that they both have the SST. These contain an additive known as a clot activator. All right, number 3 is our lavender, and I don't know if you're going to be able to see it in your tubes or not, but there's a little substance in there, right? And like on mine, it almost kind of gives it like if it rained outside on the windows, there's those little teardrops on the inside. That's an additive. All right, our light blue has a substance in it as well. So our lavender, highlight that it contains an anticoagulant, EDTA, and highlight that it obtained whole blood and for CBC. For our light blue, you're going to highlight that it contains an anticoagulant, sodium citrate. This is a common tube to use for testing your prothrombin time, your PT test. Highlight that. Our green tube, highlight its anticoagulant heparin. Our gray tube, which I don't have one on me, highlight a preservative and potassium oxalate, an anticoagulant. On number 7, royal blue, highlight EDTA or no additive at all. All right, now we're going to go over the binder in a minute. All right, so the next one, super, 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 super important, right? We need to know the order of draw when you do multiple tubes, right? Like I cannot just pick up a tube as I want. There is an order. Very, very important, okay? Your first one's going to be your blood culture tubes. And again, we're going to go over the binder, and I'm breaking it down really easy in the binder. 2 are coagulation tube. 3 are serum tubes. And 4 are anticoagulant tubes in the order of stopper color. Okay? And again, we're going to go over it in the binder in a minute. All right, case study number 2. Buzz Braden had a heart attack 4 weeks ago, and he's taken an anticoagulant warfarin or Coumadin. He is at the office for a checkup and has to have his prothrombin time tested. Blood is collected from a small vein in Buzz's left arm using the butterfly method. After the specimen has been collected, Buzz wants to know why a red stoppered tube was used to draw blood from him and then thrown away. Buzz says that he's going on vacation in North Carolina for 2 weeks. He says that they explained to him at the hospital why he should have his blood tested every week, but he's not sure where to go to get his blood tested while he's on vacation. Buzz wants to know if, as long as he takes his medication exactly as he should, if he would be all right to skip this week's thrombin time test during that time. All right, so this one's a really good case study. So let's start with what would you do?
Does this character from a small vein? Well, first of all, can I ask, wasn't it supposed to be collected on a light blue tube?
It is.
So then I guess we have to explain why they used the red one.
Yep. So because of that question that you're asking, which is a very good question, I want to go back to number 2 on our order of draw for multiple tubes. All right, number 2 is our coagulation tube, our light, ooh, I just dropped it, our light blue stopper, okay? Let's look at the note. The tubing of the butterfly setup contains 0.3 to 0.5 milliliters of air. If a light blue stopper tube is the first and only tube to be drawn, a 5 millimeter red stopper tube must be drawn first and discarded.
Wow.
This is because some of the tube's vacuum is exhausted by the air in the tubing rather than blood, resulting in underfilling of the tube. If a light blue stopper tube is filled first, the underfilled tube results in incorrect anticoagulant to blood ratio. So that is a good question. So that's why the order of draw is really important, because if your doctor's only ordering this test, then we need to pull some air out, right? We want to be able to get the air that we need. So you're probably going to draw some blood in this one, not a whole lot, some, and we're going to toss it and you'll enter this tube. So that's a very good question. Very good. All right, what else?
And then I want to say, as far as him going on vacation, wouldn't that be something though that we would just have to relate to the physician or the provider and just have him decide what it is he wants to do?
Yeah. So you're definitely going to want to talk to your provider. Now, it is very possible for the patient to go and get his blood test while he's on vacation. The one thing as a medical assistant that you can do, let's say that his insurance uses Quest as the lab that tests his blood. All right, and if he knows exactly where he's going on vacation, we can look for the Quest locations around that area. And we can go and fill out a lab form or print one off if you use an EMR and give it to him, and he can just take it to that facility at that time and they'll test his blood.
Okay.
All right, what else?
I guess next thing, make sure that he's aware that how important it is for him to have his test done, because he wants to know if he could just skip it while he's on vacation.
Yeah. And what do we think the answer to that would be?
Of course not.
That's right. No. Now, the reason being, so one, I mean, he just had a heart attack 4 weeks ago. All right. And honestly, if he had a heart attack 4 years ago, I still would say no. But it's really important right now that he takes his medication. He doesn't miss it. Now, the reason why the patient has to go once a week to get his test done is because the blood clotting time changes frequently. And the only way to monitor to make sure it's stable and that he's on the right dose of medication is to get his blood test done every once a week.
Okay.
All right, very good. Good job. All right, is there anything else that we would do, or do we already know what we're not going to do?
I can't really think of what do not.
Yeah, I mean, pretty much we kind of covered it in this one, right? Like, we definitely don't want to tell him, oh, yeah, stop your medicine. No,
Yeah.
don't want to do that. And we've been able to explain why we just took some of his blood and throw it in the trash. And then him getting his test done while he's on vacation is very possible and it is a great idea. And we've already been able to inform him on how we can help him get that done. So that's pretty much it, really. So this one's a pretty cool one. I like this case study.
Cool.
All right, evacuated tube guidelines. Certain guidelines should be followed when using evacuated tubes as follows. Number 1, select the proper evacuated tubes according to the test to be performed and the amount of specimen required. Number 2, check to ensure that the tube is not cracked. A cracked tube no longer has a vacuum. Remember, there's air, which is our vacuum, inside every single one of these tubes. 3, check the expiration date on each tube. Highlight outdated tubes may longer contain a vacuum. And again, our expiration date, let's see, on this one is on the side. Let's see if I don't know if y'all can see it. This particular tube actually is outdated. It was in 2019. Okay? 4, make sure each tube is properly labeled. Proper labeling avoids mixing up specimens. Advances in specimen identification include the use of computer barcodes to identify specimens. Laboratory instruments that do the testing are able to read the barcodes and automatically document results onto the laboratory report form for a particular patient using the identification number supplied by the barcode. Along with the barcode, additional imprinted information is included on the barcode label. See figure 17.17. It is important to attach the correct barcode label to the blood tube. Inspect label for printed information indicating the color of the stopper of the tube, for example, LV for lavender, or type of test, SST, which is our serum separator tube, to which the label must be attached. For example, the barcode labeled illustrated in figure 1717 must be placed on a lavender tube for a specimen that is being collected to perform a CBC. Number 5, before using tubes that contain powdered additives, for example, a gray stopper tube, which I'm sorry guys, I really thought I brought one from the clinic, but I think I have one in the clinic. I can show you. Gently tap the tube before the stopper so that all the additive is dislodged from the stopper. If an additive remains trapped in the stopper, erroneous test results may occur. So like if this was my gray tube, I'm going to tap and make sure that all the additive is down. 6, take precautions to avoid premature loss of the tube vacuum. Premature loss of the vacuum can occur from the following: dropping the tube, pushing the posterior needle through the tube stopper before puncturing the vein, partially pulling the needle out of the vein after penetrating the patient's vein. Number 7, use a continuous steady motion to make the puncture. Performing the puncture with a slow, timid motion or a rapid jabbing motion could cause the needle to go completely through the vein, resulting in a failure to obtain blood and possibly a hematoma. Number 8, when multiple tubes are to be drawn, follow the proper order of draw. This prevents contamination of non-additive tubes by additive tubes and cross-contamination among different types of additive tubes, which could lead to inaccurate test results. Number 9, fill evacuated tubes until the vacuum is exhausted, as evidenced by sensation of blood flow into the tube. The tube is almost but not quite full when the vacuum is exhausted. If the evacuated tube is removed before the vacuum is exhausted, a rush of air enters the tube, damaging the red blood cells. A tube that contains an anticoagulant must be filled completely to ensure the proper ratio of the anticoagulant to blood specimen. So let me show you. All right, so we see this tube.
Can't really see.
No.
Yes.
So this is probably where I would fill my blood. Like I'm going to get it as full as possible, right? But on the label, there's indentions on where you can, but I actually would try to fill it up as much to the upside of the label. All right, number 10, remove the last tube from the plastic holder before removing the needle from the patient's vein. This prevents blood from dripping out of the tip of the needle after it has been withdrawn from the patient's skin. Number 11, mixing tubes that contain a clot activator or an anticoagulant immediately after drawing by gently inverting them. Gently inversion provides an adequate mixing without causing hemolysis or breakdown of blood cells. Highlight those two sentences. One inversion consists of one complete turn of the wrist, 180 degrees, and then back again. Tubes with the clot activator should be inverted 5 times, and tubes with an anticoagulant, with the exception of sodium citrate tubes, should be inverted 8 to 10 times. Tubes containing sodium citrate, light blue stopper, should be gently inverted 3 or 4 times. Inadequate mixing or not mixing tubes with an anticoagulant immediately after drawing the specimen may result in clotting of the blood, leading to inaccurate test results. Number 12. After the venipuncture, the top of the stopper may contain residual, oh, I can't talk, blood. Take precautions by following the OSHA bloodborne pathogen standard when handling these tubes. Okay, so before we go any further, let's look at page 632, table 17.1. So this is the order of draw. And again, I've got it printed out in the binder. We're going to go over it. Certification exam, super, super, super important. So number 1, yellow, are blood cultures. That's first. Our second one, light blue, coagulation test. Red, their third one, or gold, or tiger top. Those are our chemistries. And remember, SST stands for serum separator tube. And number 4, you'll go from your light green, dark green, lavender, and then gray. All right, and again on our lavender, see it says our CBC. That's the most common laboratory use. All right, any questions on that?
So is this the order
Order of draw.
of, yeah. Okay.
Yep. Yeah, and like I said, again, I've got something in your binder and we're going to go over it, but this is the order of draw. So yellow, blue, red, SST, which is what, ladies?
SST, you said?
Yep, what does it
Is
stand
that
for?
is that the serum?
Mhm. Serum separator tube, right? SST.
Serum separator tube.
Very good. Then our green, then our lavender, and then our gray. All right, now let's go to page 633 on figure 17.17. So this is what a lab barcode, right? The labels that we put on our tubes, if we do an EMR, this is kind of what it looks like when you print it off. It already gives the patient's name, age, gender, usually a medical record number, a barcode, that's usually what the lab scans, test ordered, patient's date of birth, the name of the laboratory it's being sent, the color of the tube, testing priority, so if it's routine or stat. And then at the top, we have our specimen identification number, the collection date and time, and the ordering physician. All right. I want you ladies to turn to page 637. Please highlight the procedural step 24. And as always, reading the procedures after it's super important. Super, super important. Okay. So we just learned how to do one venipuncture, right? And what's another method? That was our vacuum tube. This is our vacuum tube. The other one is our butterfly method.
Butterfly.
Yep, that's right. All right, so really quickly, I want to show you what it looks like on the vacuum tube, right? So again, what is this called, ladies?
Flange? I mean, or
Yeah, our plastic, and this is the flange. All right, and this is what?
that's our 21 gauge needle thingy.
That's right. All right, so I'm gonna kind of this close. So see, I twist it open, and y'all see how it's rubber?
Yes.
There is a little hole indentation at the top, and it screws on, right? Like that. Okay? And then in the opening, that's where you would insert your tube. Now, I'm not going to put my tube, I'm not going to press it all the way up, right? Because I'm not in a patient's vein. The only time I'm going to do that is after I've inserted my needle into the patient's arm. Then I'm going to press my tube down. Okay? Now, if I uncap this, that's where my needle is going to be. Now, just like with our injection, our bevel is always what?
Up.
That's right. Same thing for this one. There is a bevel on the needle, and you'll see it when we get to the lab. It's always up as you're going into the patient's skin. Okay? Now, for the butterfly, a little bit different, but you can use it kind of the same way. But the butterfly is really good because you can do a syringe method. And I'm going to see if I can show you real quick how that is done. Let's see if I brought. All right. So here's my syringe. This is my butterfly kit. All right. Now, why is it called butterfly? Do y'all think?
Because it has the little wings.
Yep. Got the little wings. It's so cute and tiny. It looks like a little butterfly. And it's winged because when you hold it, you hold the wings like that. Okay. All right. So this one, all right. Can everybody see? I'm trying to go as close as I can
There
without,
you go.
don't mind my nails. I've not gotten them done in months. Okay. So for this one, there's this little cap. Well, if I'm using a syringe, see the syringe has a little squirt thing. I'm going to untwist this. I'm going to take my syringe. And then now it's connected. So then when I get blood flow through my tubing, I can pull this back and I can get blood into my syringe. Okay? Pretty cool. Now, that's with the syringe. Now, let me get my plastic tube here. And I think I brought the right part. I might not have. And don't worry, guys, we're going to go over all this in the lab, but I just wanted to kind of show you this process because this is one of my favorite chapters. Okay, I can't show you the other part because I didn't bring the right part to it. But that's how you do a syringe hookup from the deal. Okay. So now let's start reading the butterfly method of venipuncture. Jasmine, please read the first and second paragraph.
The butterfly venipuncture is also called the winged infusion method. This is because a winged infusion set is used to perform the procedure. The term butterfly is derived from the plastic wings located between the needle and the tubing of the winged infusion set. The butterfly method is used to collect blood from patients who are difficult to stick by conventional methods because it provides better control when making the puncture, and less pressure is exerted on the vein wall from the evacuated tube. The butterfly method is recommended for adults with small antecubital veins and children, who typically also have small antecubital veins. The butterfly method also is used when the antecubital veins are unavailable and veins in the forearm, wrist area, or back of the hand are used, as may occur with elderly and obese patients. These alternative veins are usually smaller and sometimes have a thin wall, such as hand veins, making them more likely to collapse with the vacuum tube method of venipuncture. With the vacuum tube method, the sucking action exerted on the vein when the pressure in the vacuum is released causes the vein to collapse, blocking the flow of blood into the tube. The butterfly method results in less pressure on the vein wall because the pressure exerted by the evacuated tube must travel through a length of tubing before reaching the vein. Because the pressure against the vein wall is minimized, the vein is less likely to collapse with the butterfly method. Procedure 17.2 describes a venipuncture procedure with the butterfly method.
All right, very good. So for this, you're only going to highlight that first sentence where it says the butterfly method of venipuncture is also called a winged infusion method. All right, let's see here. Lily, can you please read the next two paragraphs?
The gauge of the winged infusion needle used to collect the blood specimen ranges from 21G to 23G, and the length of the needle ranges from half to 3/4 of an inch. The needle is short and sharp, making it easier to stick. Difficult for small veins, a 23G needle should be used to prevent rupture of the vein by a larger needle. In this case, it is preferred to use a smaller volume tubes because large evacuated tubes may put too much vacuum pressure on the vein, causing it to collapse. Manufacturers often color code the wings of the infusion set up by gauge for easier identification. Becton Dickinson uses the following color coding system: green for 21 gauge needles and light blue for 23 gauge needles. The winged infusion needle is attached to a 7 or 12-inch length of tubing and luer adapter, which is attached to the posterior needle with a rubber sleeve. A plastic holder is screwed onto the luer adapter, which allows it to be used with evacuated tubes. Wing infusion sets also are available with a hub adapter that allows them to be used with a syringe. Safety needles are available with the shield that covers the contaminated needle after patient's vein.
Very good. Okay, so I just want you ladies to highlight the first sentence in the third paragraph where it says the gauge of the winged infusion needle used to collect a blood specimen ranges from 21 gauge to 23 gauge, and the length of the needle ranges from half to 3/4 inch. All right. Guidelines for the butterfly method. Nancy, can you please read 1 and 2?
Certain guidelines should be followed when performing the butterfly method of venipunctures as follows. Position the patient according to the site selected for the venipuncture as follows. Antecubical, wrist, and forearm vein. Position the arm in a straight line from the shoulder to the wrist as described for the vacuum tube method of venipuncture. Hand veins. Position the patient's hand on the armset and ask the patient to make a loose fist or to grasp a rolled towel. This combination causes the hand veins to stand out so that the accurate selection of of a puncture site can be made. Locate the suitable vein between the knuckles and the wrist bone. Hand veins are usually visible and easy to locate. Position the tourniquet according to the venipuncture site as follows. If the veins of the forearm or wrist are used, apply the tourniquet to the forearm approximately 3 inches above the puncture site. For the hand veins, position the tourniquet on the arm just above the wrist bone. Figure 17.20.
Very good. All right, so just like we talked about when we talked about tourniquets, whether you're doing the forearm, the hand, or the antecubital space, you're gonna always make sure the tourniquet is 3 to 4 inches higher up from where you're actually drawing the specimen. Okay. Now, something that you ladies can do at home to practice is you can practice clenching a fist, right? Drink a couple cups of water and then clench your fist and see if you notice the difference in your veins. Like for me, if I were to drink more water, then you could really see my veins and they probably would feel better. But I'm not a big water drinker, so I would be considered kind of a struggle stick because I don't have I'm not hydrated enough, probably. So drink a couple of waters and then practice doing your hand like this and then try to palpate the veins and see if you notice the difference. All right.
I do have one question.
Yeah, of course.
So I want to say that according to the blood draw that you have to do, I don't really think that it matters where you get the blood from, correct?
You mean like if I'm drawing one test, it's better doing the arm than the hand? Is that your
Right.
question, right? Yeah. No. No, that doesn't matter. You're right. It doesn't. It mostly matters in being able to get enough blood for the test. Now, in some cases, like if a patient looks like they're going to be a really hard stick, then I'm going to really make sure that I find a good vein, whether it's on the hand, the forearm, or the antecubital space to get my specimen because I need to make sure that I get a lot of blood in my tube. So no, it doesn't really matter where as long as you've got a good site.
Because I noticed that when anytime they have to draw my blood, they've always, it doesn't matter who it is, they have a hard time finding my veins in the antecubical site from both arms. And I remember one time a medical assistant, it was so hard for her that she was just so tempted. She's like, I really just want to give up and just draw it from your hand. However, for some odd reason, she didn't want to. It's like they were scared to draw it from the hand and they kept trying somewhere else. And I didn't know if it was that or if it just made a difference, maybe because of the amount of blood they had to draw. I didn't know.
Yeah, it's mostly so the vein drawing blood from the hands. I mean, you can totally do it. A lot of people love to do it. A lot of people don't like to do it. So it's more of a preference. So that's why some people don't like using the hand. But another reason is because there's not a lot to support the veins, right? There's not a lot of tissue. It's right under the surface of the skin. So it's more sensitive for the patient. And sometimes it's just the patient's too uncomfortable. And if the patient's uncomfortable, you're not going to be able to obtain your specimen. You know, everybody that draws blood is different, right? They all have their preference. I personally don't care as long as I get blood.
Right.
So I'm going to look at everything. Now, for me, everybody loves to go right here. Now, the downside of that is because through the years of medications and treatments and things like that, my veins are not as good as they used to be. It's a good vein, but that doesn't mean you're going to get anything from it. So it's not an exact science. Like you just have to go through the things, right? Like you have to feel the vein. Does it feel big? Does it feel real elastic? Like I've got a lot of blood flow through that one. Does it roll? right? I mean, do I think it's going to roll? If it's going to roll, I'm probably not going to draw there. It's a preference, but as long as you go through I've done this, I've done this, I've done this, I still feel confident that this is a really good one, then that's all you need to do.
Okay.
All right. Natalie, can you please read 3 and 4?
Grasp the needle by compressing the plastic wings together. Insert the needle with the bevel facing up at a 15-degree angle to the skin. When the vein has been entered, decrease the angle. After decreasing the needle angle to 5 degrees, slowly thread the needle inside the vein an additional 1/4 inch. This anchors or sets the needle in the center of the vein and allows the medical assistant to use both hands to change tubes. To prevent... Oh, do I keep reading?
No, just 3 and 4. I mean, if you want to, I'm not going to stop you.
Can I read 5 and 6?
Yeah, if you want, go for it.
Okay. To prevent venous reflux, keep the evacuated tube and holder in a downward position, as in the vacuum tube venipuncture procedure. Ensures that the blood flows from the bottom up and not near the rubber stopper. When multiple tubes are to be drawn, follow the proper order of draw. The order of draw for the butterfly method is identical to that for the vacuum tube method previously presented. Following this order of draws prevents contamination of non-additive tubes and cross-contaminations of additive tubes.
All right, very good. So on 3, I want you to highlight where it says a 15-degree angle to the skin. When the vein has been entered, decrease to angle to 5 degrees. On number 4, you're going to highlight the first sentence. And then the first sentence on number 5. All right, let's go ahead and start with our case study number 3. Maud Gabriel is at the office complaining of persistent headaches and abdominal pain over the past 3 months. The physician gives Miss Gabriel a laboratory requisition to have her blood drawn and tested in an outside laboratory. Miss Gabriel says that her daughter, who lives with her, works as a phlebotomist at the local hospital. Y'all can't talk today, I need more coffee. Miss Gabriel wants to know whether her daughter can draw her blood at home and then drop it off at the laboratory. She says that the last time she has had her blood drawn, they had to stick her 2 times, and then she got a big bruise on her arm afterward. She says the laboratory technician kept digging around in her arm to find the vein, and it was quite painful. All right, so what would you do?
I don't think they can draw her blood at home, right? Even if her daughter or whoever is a phlebotomist.
Mm-hmm. Yep, it's only the specimens are only acceptable if they're drawn in a laboratory or
Okay.
at the medical office.
So I guess we can start with explaining that to her.
Yeah. Yep. Very good. All right, what else? Anything else that we would do?
I guess we can try to reassure her. I mean, we can't. I want to say we can't reassure her that the same thing won't happen that happened last time, but try to make her feel more comfortable about the procedure.
Yeah, I mean, I will be trying to teach you guys to not start what we call fishing the vein, finding the veins, because it can be uncomfortable. Now, once you've been doing this for quite a while, right? This is a big thing that the more you do, the better you get at it. And It's just kind of one of those things. So, you know, at that point in time, definitely, like if you feel you're close to the vein, you kind of want to wiggle around, but you just have to do very carefully, right? Because some patients can really feel that and it's very uncomfortable for them. But a patient can still bruise. Like we can't promise that they won't. We're just going to do everything that we can so that doesn't happen.
Right.
Yeah.
And I think that I could be wrong, but I think sometimes when you're starting with a patient, I guess I'm not visualized, but you have to like look at her arms and her hands and everything, and just kind of you start getting an idea of what looks like a good site to
That's right.
draw
That's
from. So that way, we're not just poking at her with our fingers also.
that,
And I probably want to say don't take more than maybe 2 minutes on each arm trying to find a vein.
that's right. And why would you not want to take any longer than that?
For a couple of reasons. For me, I think it's like you said, you don't want to cause any. Some people are just so sensitive, and you just don't want to cause any type of bruising or soreness. Another is you don't want to make that patient feel uncomfortable. As does she know what she's doing, or is there something wrong, kind of thing.
Yeah. Another reason is that, if you're in the vein, that means you have the tourniquet on, right? And we can't leave the tourniquet on no longer than a minute. So at that point in time, then you would want to, right, be like, okay, look, now the one thing that I'm going to teach you guys is until you do become like super confident and you've done a lot of venipuncture draws, then you can try to stick the patient again, right? Like multiple sticks. But I'm going to teach you one and done, right? Like if I tried once and I didn't get it, it happens. But go find another lab tech, another medical assistant. Sometimes even doctors will do it for, doctors are happy to go do it. Just so that way that helps the patient stay comfortable, right? Like so that you're not getting multiple sticks on them. All right, very good. Is there anything else that we would do or not do?
We would advise her to drink water before she goes so that her veins are more, like she's more hydrated and they might be able to see her veins more.
That's right. Again, hydration is a really big key when it comes to drawing blood specimens. So even if that means that you don't stick the patient right now, go get the patient a glass of water, maybe warm up a glove or a hot pad to warm, or have the patient wash their hands under warm water. Just something to really get those veins popped out and really get that blood flowing. All right. Okay. So, very good. Now, because it is already almost 11:30, I'm gonna go ahead and finish with the spots that you need to highlight, and then just, finish reading the rest of the chapter. Make sure you go over the procedures, because I also want to touch base on the binder assignment, okay? So go ahead and turn to page 646 for me. Under failure to obtain blood, I want you to highlight the first sentence. In the third paragraph, highlight where it says recommend removing the needle rather than trying to probe the vein. Again, digging for the vein. Probing is often uncomfortable for the patient and can affect the integrity of the blood specimen, leading to inaccurate test results. For the inappropriate puncture sites, highlight any skin areas that are scarred, bruised, burned, or adjacent to areas of infection should not be used. Highlight on an arm with an edema or an arm on the same side of a mastectomy. So again, if your patient has had a mastectomy on the left side, we're not going to draw any blood from the left side. Also highlight an arm that has a cast applied and side as a radical mastectomy. Under scarred and sclerosed veins, highlight where it says the veins feel stiff and hard when palpated. For rolling veins, highlight that last sentence. For collapsing veins, highlight the first and last sentence. On figure 17.21, highlight B, C, D, and E. On page 648, in the paragraph above hematoma, highlight where it says blood may be forced out of the puncture site. In hematoma, you're going to highlight the first sentence and the last three sentences. Under hemolysis, highlight where it says hemolyzed blood specimens produce inaccurate test results, and then highlight number 3. Under fainting, highlight where it says the most immediate concern is to protect the patient from injury. Under serum, in the second paragraph, highlight the second sentence.
What do we highlight under hemolysis?
Where it says the hemolyzed blood specimens produce inaccurate test results, and then highlight number 3. All right, on tube selection, highlight the following. Because the amount of serum recovered is only a portion of the specimen, a blood specimen must be drawn that is 2.5 times the amount required for the test. If 2 milliliters of serum is required, a 5 milliliter tube of blood must be collected. If 3 milliliters of serum is required, an 8 milliliter tube of blood is collected. If 4 milliliter of serum is required, a 10 milliliter tube of blood is collected. Under preparation of the specimen, you're going to highlight the first sentence and then highlight that the result of this is the formation of the fibrin clot in the layer. A fibrin clot is a spongy substance that occupies space, interfering with adequate serum collection. For the removal of serum, you're just going to highlight where it says the specimen is centrifuged for 10 minutes. On figure 17.22, highlight fibrin clot and highlight a fibrin clot may interfere with adequate collection of serum. Under serum separator tubes, highlight the words red, gray, stopper. And then we're going to go on over to page 653. under skin puncture. So that was venipuncture, right? We did the vacuum tube method, and then we did the butterfly method it went over. The other part is our skin puncture. So on page 653, in the first paragraph, highlight the words capillary punctures. And this is something else that we'll be doing in the clinic. All right, under puncture sites, in the first paragraph, you're going to highlight the first two sentences. The puncture site varies depending on the age of the patient. The fingertip of the third or fourth finger is the preferred site for a skin puncture in an adult. In the next paragraph, highlight an infant birth to 1 year old. The skin puncture should be performed on the plantar surface of the heel. And highlight after a child has begun to walk, the skin puncture can be performed on the fingertip. All right, skin puncture devices. In the second paragraph, highlight the following. Regardless of the skin puncture device, the puncture must not penetrate deeper than 3.1 millimeters in adults and 2 millimeters in infants, plantar surface of the heel, and children. If the puncture is deeper than this, the bone may be penetrated. Now, most devices are only going to allow you to go so far, right? The needle is only so long. Now in figure 17.24, these are lancet devices. Pretty cool. On page 655, really quickly, look at figure 17.25. So these are the collection tubes for capillary punctures. You have your micro collection tube and capillary tubes. We're going to be doing the capillary tubes in the clinic. All right, and then turn to page 656. Highlight the first sentence on number 10 and the last sentence on number 11. All right, and then I want you to look at figure 17.26. All right, so this is my middle finger, okay? You are never going to puncture here. You're going to puncture here.
Can't see it.
Here. Can you see it?
You have to move it a little more. There.
A little more? Okay, and y'all, I'm not trying to flip you off, I promise. So you're never going to go here. You're going to go here or here.
Okay.
So never in the middle, but I can't draw it. Never in the middle, but on the outside. But not here, right? Like if I go on the edge here, that's going to hurt. So you want to go on the fatty part of the finger, but just not in the middle, right? Like kind of in between on each side. So you can look at your own finger and kind of map it out. But on the figure, it shows you, right, to the side.
Miss,
Yes, ma'am.
I just discovered something. I always thought they did it wrong. Like they were supposed to put the hole in the middle. And I was like, and I always told my mom, look, they did it on the side.
Yep. No, I promise you, when I was in medical assistant school, you know, just like with you guys in the clinic, you get to practice on your fellow students. And I had a student that practiced on me, and she went in the middle of my finger. I have never experienced so much pain and soreness forever on my finger. It was ridiculous. It's, yeah, don't go there. But they did it right. If they didn't go there, then they did it right. All right. I know we've been recording for almost 3 hours, so I appreciate y'all's patience. This is a big chapter, but it's a lot of fun. I love this chapter. Any questions over anything so far before I ask you guys to get your binders out? Okay, so turn to your binders. Okay, so the first thing that you ladies should see is your order of draw. Okay, so here's the order of draw. Like it has our colors. It's got yellow, blue, red, or SST, green, lavender, gray. So make sure that you read that over and study it. So the order of draw, the mnemonic example, right? It kind of gives you an example that you can kind of sing to yourself to help remember the order of draw. So we got young for yellow, bodies for blue, really for red, should for SST, get for green, large for lavender, grains for gray. So young bodies really should get large grains. Now, I've had other students that have kind of memorized different things, and that's fine. It's just something to help you be able to memorize the order of draw because it is so important. And it's also really important on your certification. Okay? All right, so the next thing that you ladies should have is, well, I have to get that in a minute. It is going to be your venipuncture tools. Right? You should see one that looks like this, and then one that looks like this. All right, so this is one that you will need to do and send it to me by midnight tonight. It's your order of draw. Right? It's an A, B, C, D, E type question test. The next one is another order of draw quiz. Again, due by midnight tonight. And then you should have a thing of just your veins on your arm, just to kind of help you learn to map it out. Not walk it out, map it out. All right, any questions?
So I'm assuming That it says order of draw quiz. That's just the order we would draw the blood, correct?
That's right.
All right.
What tube colors are you going to use?
All right.
Yeah, that's right. So let's look at the first one. Let's see here. So number 1 says blood cultures are used in microbiology. The additive it uses is a broth mixture that is extended to preserve the quality of microorganisms. Which tube top color is blood cultures?
The yellow.
That's right. So that's how you're going to do that quiz. And then on the other one, you're just going to actually list the correct order of draw. Like, which one goes first? Which one goes next? Which one goes next? Follow, 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 follow. Okay? And then don't forget to send me your chapter 16 study guide results. For a lot of you, I've still not received chapter 15. I need that because I don't want to do zeros for anybody. And then make sure you do your chapter 16 test and evolve and your chapter 17 evolve assignment. Okay?
Daniel, I'm gonna be honest with you.
Huh?
I'm gonna be honest with you.
What's that?
I don't remember doing 15. Did we do that before the week that we were off, or did we start that this week, or what?
Okay, so we covered chapter 15 before y'all were off last week, and then we graded chapter 15 yesterday, the study guide.
Okay.
Now, if you look through the chapter and you still don't quite remember maybe going over it, not a big deal. Couple things you can do. The YouTube video should be posted. But you can also schedule a one-on-one tutoring with me, and I'm happy to go back over it again. That's not a big deal at all.
Yeah, okay. I think that's what I'll do.
Okay. But did you do your Evolve chapter 15 assignments?
You know what? I did my Evolve yesterday for chapter 15. I think it was my test bank. I have to go back and see if I did my 15 acknowledge and all that, because I don't remember 15.
Okay.
And yesterday I kept thinking about it.
So
what I'm very behind on right now at this point, I'm gonna say, is 16. I think that was due yesterday, correct?
Correct.
So I guess I'm just gonna try to start fresh today with this, and then maybe get back at you with 16.
Yep.
Alrighty.
Yeah.
Thanks.
If you guys, so I'm always willing to work with you guys. If you let me know whatever reason, maybe internet went down, things are crazy right now. Let me know. And usually what I'll do is I'll try to open them up on Friday, because then I can give you, depending on how much you need to make up for that week, I can give you all weekend to do it. So
Thank
yeah,
you.
just let me know. I'm happy to help every single one of you guys. You just have to communicate with me. Okay, so I'll probably send a reminder to the ones I've not received on chapter 15 today. And then just make sure you guys have sent me chapter 16. All right, any questions?
No.
Okay, make sure you practice your tourniquet, right? Practice, practice, practice. Because I want you ladies to have that down before we even get to clinic.
Okay.
All right, very good, ladies. But y'all have a great day, and then I will let you know when this morning's live lecture's been posted on YouTube. Okay?
Sounds good. Thanks.
All right, you're welcome. I'll talk to you ladies later.